Hello, everybody. This is Steve Sokol, the president of the American Council on Germany. As some of you know, the American Council on Germany has a special focus on bringing together German and American decision makers and practitioners at the local level through study tours, leadership missions to explore the common challenges and the opportunities facing cities on both sides of the Atlantic. These practitioners also share best practices, and our hope is that through the active exchange of ideas and experiences, they can develop policy solutions to the common challenges faced by cities in Germany and the United States. In both countries, cities are on the front line of the coronavirus, and they're feeling the impact of this pandemic on multiple levels. To share how cities in both countries are being affected, the ACG is pleased to launch a new series of conversations called Transatlantic Perspectives, the Local Impact of COVID-19. We will engage experts, practitioners, and ACG program alumni to hear how communities in Germany and the United States are confronting the challenges posed by the pandemic. To kick off our series, I'm very pleased to have 4 guests with us today. Tobias David is the strategic advisor to the mayor of the city of Leipzig. He participated in the ACG's McCloy Leadership Mission on Urban Affairs and Sustainability in 2016. Thanks for being with us, Tobias.
Hello, nice to see you.
Blaine Griffin is a member of Cleveland City Council. He participated in the ACG's Transatlantic Cities of Tomorrow, Digitalization and the Future of Work initiative in 2019. Blaine, it's good to have you with us as well.
Good to be here. Thanks for having me, Steve.
And Jimmy Jost is the head of science and communication in the city of Heidelberg's Office of Economic Development and Science. She's been a great partner to the ACG in her current position, but also in her previous positions over the past decade. Jimmy, it's wonderful to see you.
Thanks for having me.
And last, but by no means least, Stephanie Welch. She's the deputy to the mayor and chief of economic and community development in Knoxville, Tennessee. Together with Blaine, she also participated in last year's exchange program on digitalization and the future of work. Thank you for joining us today.
Thank you. Thanks so much for having me.
Well, a big welcome to all of you. We're absolutely delighted to have you with us. And I'd like to start our conversation by asking each of you to give us a general sense of how your city is coping with the pandemic. What are some of the biggest challenges you are facing, and what have been some of the measures that have worked well in meeting this unprecedented situation? Stephanie, perhaps we can start with you. How is Knoxville, Tennessee's second largest city with a population of just over 185,000 people, being impacted?
Great. Yeah. Thanks so much again, Steve, for having me here today. And greetings from Knoxville, Tennessee. Just a minor tweak. We are one of the largest cities in Tennessee, but we're the 3rd largest. So I don't want to downplay the importance of Memphis and Nashville in our state as well. So just a couple of things that I think provide some context around one of the most challenging aspects of this pandemic is just been leadership decision making. And we could talk about this for a long time about how our federal public health response has affected our ability to make decisions at the state and then eventually at the local level. But I'll provide a little bit more of a local context in that in Tennessee, our cities do not have their own health departments. They don't have their own public health entity. So we rely on the county in which we reside to provide that public health infrastructure. In Tennessee, as in most parts of the United States right now, there is a pretty significant political divide, political worldview, philosophical divide about the role of government. And cities tend to be a little bit more proactive in their governmental solutions, and counties tend to have a more libertarian approach and more of a personal responsibility type of approach to dealing with issues in communities. So that creates quite a challenging scenario when the governmental public health entity is under the purview of a government that may have more of a less government type of approach, and our city governments, which have no direct authority are trying to make decisions to protect public health without that tool at our disposal. So it has been an ongoing challenge of just decision making and how we're doing that. I do believe that we've been very fortunate in East Tennessee. Our mayor did put take some early action that I would say it went beyond flattening the curve here in East Tennessee. We haven't even had a curve. Right now, I think we have about 28 active cases in our entire county of 500,000 people. So that's a pretty significant, I think, success that we've had. And so we're right now at the point that we're making decisions about opening, phased reopening of businesses, and trying to do that in a very methodical approach using the best public health guidance. And again, just navigating the challenges of a city and a county government. And then just one more thing I'll mention is that oftentimes, at least in Tennessee, cities are where we go for a lot of social services. So of course, the social service needs in this environment have been really incredible. So we're working really hard to try to meet those needs as to the best degree possible, while our revenues are declining because our sales tax revenue has gone down. So I think that's just a little snapshot of some of the challenges we're facing here in Knoxville, and it continues. And I think it's only going to get harder, to be honest with you, to make decisions going forward.
Stephanie, one of the things that I think all of us read about and are familiar with is sort of the urban-rural divide. And listening to you talk about some of the tensions between the city of Knoxville and the surrounding counties makes me wonder if you think that some of those tensions will be exacerbated because of the current pandemic.
I think they have been exacerbated because of the current pandemic. And I think that's sort of our constant challenge, is to determine how to, my background is in public health, by the way. So I'm in economic and community development, but I actually have a 15-year career in governmental public health with a master's of public health. So it's been an interesting role to be in. We continue to try to help our decision makers look back to public health science and good public health policy to make decisions, rather than, and I'm just going to be blunt about it, sort of speaking to their base, which we're in this place probably all over the United States and most of the world right now, where our elected leaders oftentimes have a small base that is informing decisions, and we need to sort of step back from that and really look back to public health science and good public health policy. So that's what we're trying to help our leaders focus on.
Maybe one final question to you before we move on to the others, since you were talking about political leadership. In December, India Kincannon was sworn in as Knoxville's new mayor. And the pandemic is a huge challenge for all communities under the best of circumstances, but it must be particularly daunting for a brand new administration. Can you talk a little bit about how city government is coping?
Yes, I mean, thank goodness we have had really strong leadership in our city for decades, I would say. We've had really good leadership. So I think we have a mayor who has good experience. She's served in other elected offices. She has good decision-making skills. So that has been, of course, tremendously helpful. But for any organization, when you have new leadership, I was on the job for about 3 weeks when the pandemic really sort of began to hit East Tennessee. So she had been on the job for just 2 months. So yeah, we're still trying to form your team and figure out where the copy machine is and, how to get in and out of the building. To be honest with you, that's sort of where we were at. How do I get a stapler for my office? Those were the questions that I was still asking. And then we were having to make these major policy decisions during an unprecedented global pandemic. So thankfully, all of the previous strong leadership, I think, has set us up in a really strong position to be able to just continue moving forward and use that foundation as our strength as we do that.
Thank you, Stephanie. Blaine Griffin, Cleveland, Ohio is about twice the size of Knoxville, Tennessee, with a population of 385,000. And before we went live, you were saying that Cleveland's response to the pandemic has been kind of an ebb and flow. You believe that you're flattening the curve, but can you talk to us a little bit about what the situation is or what the conditions are actually like in Cleveland and where you've seen the biggest impact on the community?
Absolutely. And first of all, thank you, ACG, for having me. I really appreciate it. Stephanie eloquently described what we deal with in urban communities often, that rural-urban dynamic. We have a Republican governor who has made a lot of decisions that, quite frankly, have been great decisions, and he has done a great job leading us through this situation. I'm a Democrat. Most of our city and most of our county is Democrat. So we've been able to work together because in the past, we've had a pretty good infrastructure in place because of the civil unrest that we've experienced through police-involved shootings, RNC, other types of protests, that we had a pretty good infrastructure in place and a pretty good working relationship to work across parties, to work across jurisdictions. However, what this coronavirus did is highlighted something that we've already known and something that I introduced as in legislation about a month ago, is that that racism is a public health crisis. And we're seeing health disparities in urban communities where coronavirus is hitting communities of color a lot harder than they are some of our white counterparts. So for example, Cleveland is a city of approximately 52% African-American city, another probably 9% Hispanic, and then probably 2% Asian American. The rest of the community is white. And we are seeing that the cases of deaths as well as the cases of infection are higher and disproportionately impacting poor and minority communities. This is something that we've known that's been an issue, but this has illuminated that fact in the city of Cleveland. So as we make policies, one of the things that we've been pushing with the governor, as well as with the mayor, as well as with our private institutions, which we have the Cleveland Clinic and University Hospitals, is to collect the data on race and ethnicity. It's important to collect that data just from an epidemiology standpoint, because you want to understand why are some of these communities being disproportionately impacted. And I know that Ms. Welch is a public health director, so she knows this. We already have social determinants of health in the African-American community that help contribute to this. Poor air quality, diabetes, blood pressure, high blood pressure, obesity. And I think that it's critical and it's essential as we make decisions to make sure that we collect the right data. So it's highlighted some weaknesses in our system, and we'll talk about the digital divide later, which I think is another thing that this is highlighted, and ACG opened my eyes to that, of how far behind we are in some of the digital divide, but it's really illuminated some of the racial disparities. But we've been able to get through because of the working relationship we do have across jurisdictions.
Well, and let me follow up with that comment about across jurisdictions. Both you and Stephanie started talking a little bit about the different levels of government, the state, the federal, state, and local governments, and how they interact with each other. And Blaine, you just very eloquently talked a little bit about Ohio's governor and the fact that he acted earlier than the governors in many other states to implement stay-at-home guidelines. Do you think that that helped slow down the outbreak a little bit in Cleveland?
Okay, most definitely. I think that the governor made some very critical early decisions along with Dr. Amy Acton. And I think with their decision making early in this process was one of the reasons why we were able to mitigate this sooner than most other states. The only place that we're starting to see a spike and we're starting to see a real problem is in our penal systems, because they're in close quarters. So the guards and the inmates are starting to see high rates of infection and death in these communities. And I do have to say this on a personal note, why this health disparities and race disparities are so critical to me. My stepmother has actually been diagnosed with COVID-19. She lives in Youngstown, Ohio, predominantly African-American community. And she actually is fighting for her life right now. So it's critical that the governor understands, and he has, because he works with me on a lot of other issues, critical issues affecting our urban environment.
Well, obviously, we wish her well in a speedy recovery, because this is a challenging disease on purely a health level. And when you think about the public health implications as well as the public safety implications for us all, it makes it very, very challenging no matter where one lives.
Right.
I'd like to maybe cross the Atlantic to Tobias David in Leipzig. Tobias, Germany seems to be weathering the pandemic a little bit better than many other countries for a variety of reasons. Part of it has been early testing and widespread testing. But can you talk to us a little bit about the situation in Leipzig, which is Germany's fastest growing city with a population of over 560,000 people?
Yes, of course. Thank you for the invitation again. Tobias David, city of Leipzig. Leipzig is the 8th largest city in Germany, and we are grown in the last 10 years up to 600,000 right now. And in the area of Leipzig, there are living more than 1.5 million people. So for your classification about Leipzig. The pandemic started in Leipzig in the early March with the returning of the travelers from the ski areas in Austria. The number of infections rose up very, very quickly here too, from 1 infection per day to 30 in the next day. So we had to respond very, very quick. In this time, the city of Leipzig immediately convened an urban crisis team very early in March. And we involved different parts of our administration, local administration and also state-run administration. So our health department, the hospitals, the fire and the rescue service, the police, our social welfare office, and also the army, the Bundeswehr, our communication department. And in this situation, in this crisis team, our mayor was the leader of this crisis team, and we have meetings all the day since the beginning of March. Leipzig tried to ban all events from the beginning of March until now. First, we cancelled all events over 200, and shortly all others later. We closed the playgrounds and so on. Right from the start, our strategy was to contain the pandemic and to expand the medical infrastructure. This would be the most biggest points. We worked very good together with our local government, our state-run government, and the federal government. And the federal government spent a lot of money, so they asked to increase our capacity of ICU beds, and postponed operations should be planned. Operations should be planned later. It worked very well. The government paid the clinics €560 per bed, per empty bed. So to keep the beds empty for the upcoming patients, and the federal government paid also €50,000 per additional ICU bed. So in this time, we did this, and we expanded also our test capacities from up to more than 3,000 per day in 5 stations around the city, and started to test intensively. Every person suspected of being infected was tested, usually several times, and quarantined for 14 days. After the quarantine ended, testing was carried out again. And this is very important, all contacts of infected people have been tracked by our health authorities and also tested and quarantined. We implemented a lot of additional stuff in our health department. For example, all people in quarantine had to report daily to our health department and keep a diary of their symptoms. In addition, to this, we send people to them to control that they are home. From the 23rd of March, we have a completely lockdown in Germany with contact restrictions, and all shops are closed. It worked very well. So far we have only 550 persons infected and 2,800 people quarantined. Only 6 people died. The biggest challenges we had was to getting adequate protective equipment, masks, clothings, because everything comes now from China, and it's simply nothing was produced here. Is now stabilized. I think the situation is different in any parts of Germany, but we are in a very good situation that we have not too many infected people and could contain the pandemic. Thanks to our well-developed hospitals, after this, we had such a good infrastructure to help our European neighbors. So patients from Italy were flown in to our hospitals, and we could help them. In my summary, we can say that we have a good infrastructure of private and public hospitals, and they're all there working together in our crisis team with our health authorities, and we tracked our contacts, and it works. So yeah, that's the situation right now here. And the next weeks, the lockdown regulations will be relaxed, so the first children can go back to school, and shops under 800 square meters are allowed to reopen since this week. But everyone has to wear a mask in shops and public transport. We are observing very, very closely how this loosening affects the infection process. Infections are currently a little bit slightly increasing. The next days will be crucial.
Tobias, do you have any, one of our viewers is asking if you have any sense of the number of reinfections that you're seeing.
No, we don't have these. No, we couldn't measure it right now, but we tested a lot of we tested a lot of people, and in our we've tested our fire brigade, the workers in our fire department, and we could find some of them had COVID, but didn't mention it. Mm-hmm. So, but we don't have completely screened our people there. No.
So in the conversation just now with Stephanie, we were talking a little bit about the urban-rural divide around Knoxville, and in the conversation with Blaine, we were talking a little bit about questions around social cohesion, a lack of social equity, some segments of the population being more heavily affected by the pandemic than others. Obviously, issues like these are issues that face German cities as well, in terms of what's the relationship between the city and the surrounding region, but also, are there people who are left behind in general, and has that situation become exaggerated because of the pandemic? Can you pick up on either or both of these themes?
Mm-hmm. I think the situation between the city and the areas around is not very different, because we are working very close together, and the city of Leipzig is serving the cities and the areas around as well. But we have the problems we're facing now are additional problems. Let me show you some examples. We needed additional accommodations for homeless in a very short time. Yeah, and yes, of course, we need additional women's shelters, because you wouldn't believe it, but sex workers would not earn money. And family violence. is a problem as well, because when the families stay at home, you don't have a view to the situation of most of the children. They are at home and not at school, and you couldn't see the problems in the early time. So
yeah, I mean, I think domestic violence is something that certainly we read about a lot as being on the rise because of this, because people are stuck at home and not able to get away. So last, for this first round of conversations, I'd like to come to you, Jimmy Jost, in Heidelberg. Heidelberg, of course, is a smaller city than Leipzig. It's closer in size to Knoxville, with a population of about 160,000. Nearly 30,000 of those inhabitants are students at the university in Heidelberg. How is the city administration confronting the pandemic?
Yeah, I could basically sign almost everything Tobias just said about Leipzig, because I was just kind of going check, because Heidelberg kind of reacted very similarly. So to try to err on the cautious side. So very early, when people returned from Austria and Italy, for instance, people were encouraged to self-quarantine themselves for 2 weeks and stay at home, so to not spread the virus. Then, of course, we are very lucky here in Heidelberg because we have one of the best health centers in Germany, in the city, and the university clinic and the German Cancer Center, which also does a lot of research now in this regard. They work very closely, so they were part of the task force the mayor convened. And I must say it really worked very well. You asked early on how the cooperation works between the city and the surrounding governments and any kind of agencies, and it works really, really well. Everybody is trying to get ahead of the situation. And as you mentioned earlier, I'm pretty new to public administration and city government, and I must say everything I've heard beforehand about kind of doing your 9-to-5 job, you can all forget about this. Everybody is really working around the clock and communicating and cooperating really well to get ahead of this, and that applies for the city and all the agencies and for the universities. So in this case, Heidelberg has been, I would say, cautious but also lucky to contain the spread of the virus. We are screening a lot and testing a lot. It was very easy. I mean, I came back from Austria, so I was tested myself. It was really, really, really easy. So we are trying to test, like Leipzig just said, everybody who might be infected, and then of course track it down. We track people who are infected, and we have these corona taxis who go around and to really get a grip of this. And so far it worked, and that also applies, fortunately, for the elderly homes that have been affected in many areas. So we are being very, very careful in that regard. And so far, we were not as badly hit as a lot of other areas in this regards. And you just mentioned masks and security devices. That also was the struggle at the beginning, but Heidelberg used all their contacts in China with sister cities and also companies here in the area who have contacts in China. And I must say also the business community was very helpful. They jumped in, used their connections. So we were able to get masks to Heidelberg. The city even donated close to 300,000 masks to the state of Baden-Württemberg just this week, because we were able to get them from China. We were helping doctors' offices, and we also prepared a starter kit for our stores who were open this Monday for the first time. So they got a little starter kit, a package of masks and some disinfection for hand disinfection to help them ease into the new reality now of being reopening. And also what the city also does is that we really control and make sure that people really make sure if they go, I mean, it's not, people always talk about the lockdown. It's not really lockdown. I mean, we are allowed to go out, to go to the stores that are open, to go for walks. There's no restriction unless you don't adhere to the 1.5 meter or 6 feet
Distance.
Thank you. You have to keep to the people who keeps you company. So you're only allowed to go out with one other person that's not a member of your household. And the police is really controlling that. And that at the beginning, people were throwing Corona parties, I think like everywhere in the world. But since this was really heavily controlled, and people did realize after a while that it is a good thing to do, and to stick to the rules, so that really helped. And so Heidelberg got on top of this and really went out there and made sure that the stores closed, and the people were doing what they were supposed to be doing to keep everybody safe. And even before the state and the federal government recommended masks, we were trying to get people to wear masks even on a voluntary basis. And since we are able to provide them, so that was also turned out really well.
So Jimmy, you know, one of the things, and both you and Tobias touched on this, one of the things that we've been reading, certainly in the US press, is the mortality rate in Germany has been very low. And that's been something that Germany has gotten a lot of credit for, largely due to the extensive testing. And that's something that both of you spoke a little bit about. Germany now obviously seems to be ahead of where we are in the US in terms of trying to reopen the economy and recover from sheltering in place and from a lockdown. You and I exchanged a couple of emails in anticipation of today, and you mentioned that after 3 weeks of working from home, you've actually been back in the office since Easter. So that's about 2 weeks ago at this point. And as you just mentioned, this past Monday, some stores have reopened. Can you talk a little bit about how this transition has been for the city? Because I think that could be interesting for some of our American listeners as well.
First, because you first mentioned the testing, I think part of why the mortality rate is so low is that Germany tested more. So I just read, I mean, you all know, you've all read that you found out that a lot more people have been infected in California, for instance, as an earlier time. If there had been more testing in the US, the mortality rate probably would be lower there too. And of course, but I don't want to start this whole discussion about the different health system. Of course, that makes a difference if you don't have to pay for things, if you have health insurance, etc., and are encouraged to go and see the doctor. But you just asked about the transition. Of course, when this all hit, I mean, it hit the city government on all levels. I mean, not just that the city had to go out and help the citizens and the businesses and the schools and you name it, and the hospitals, but also the city itself had to reinvent themselves and to make sure that everybody was able to work from home and that the communication was stable. And I must say it worked pretty well. I mean, we were using, I don't know, Skype Business, I don't know, no branding here, sorry. And it worked really well with video conferences. And some people went to the office all through the whole time. So we, for instance, at our business development agency here, we had some people at the office all the time, all through the whole weeks. And the other part was working from home, and we kept the same people at home or at the office. So in case somebody got infected, that we could just switch. And but of course there were security measurements that people had to keep in mind. But I must say the community and the communication worked really well, even though people worked at home partly. And starting this Monday, everybody is back at the offices unless the office is so crowded that you can't keep 6 feet away from each other. Then people are still at home offices. But otherwise, the whole city government is back at work.
I think that's one of the models that's obviously being considered here in the US as well by a lot of companies, a lot of employers, of staggering people's returns. So you've got, you know, one group in that's Monday, Wednesday, and Friday, and one group that's in on Tuesdays and Thursdays, but everybody continues to work from home when they're not in the office. I'd like to come back to Stephanie and Blaine. We've heard a lot from Tobias and Jimmy about testing capability in Germany, and we hear a lot about the lack of testing here in the US. Can each of you talk to us a little bit about what the testing situation is like in Cleveland and Knoxville, respectively?
Blaine, do you want to go ahead?
I'll start first. We have been the testing has not been good. Let me just make it clear. And I think my good friend Susanna, who's my cohort class for ACG, brought up a good point in the chats, is that states that have not expanded Medicaid or Medicare coverage have also had more challenging testing because only the private institutions originally were testing, which means that a lot of people who did not qualify for that private testing did not get an opportunity to get tested. There were not enough kits that were made available to the states. There are still not enough kits that are made available. So our testing has probably been the weak spot of all of this, which is why we've had such a large spike in the curve in areas like Cleveland and New York and other places like that. So I just think that that's been the one area that I don't believe that the federal government has really helped in the testing area.
Yeah, so I'm gonna just piggyback on what Blaine was saying and maybe take a bigger policy perspective that I think this really points out. It's been so interesting to hear from Tobias and Jimmy. The differences in our systems really does impact our response. And I would say that I was also checking off the same things as Tobias was going through his, Leipzig's process. We did the same thing, except it was like 10 times harder because there was no cooperation, no national response, no coordination at the state level. So testing is no different. I mean, the United States made some decisions around testing that led to a really messed up system of testing. We don't have enough tests. I mean, that just is the reality. I'm going to give you an example. We were doing a testing event here in Knoxville earlier this week, and 1,500 of the test kits that were supposed to come to Knoxville got diverted someplace else. We have cities literally competing against each other to protect the health of the public. This is one time, and I think remarkably, the states has fared pretty, we haven't fared very well. I mean, and you all watch the news the same as we do, but we have found ways at the local level to overcome, and I think Knoxville is actually a success story, but we've had to do that by fighting and clawing our way through this process and just politically navigating the waters. So the fact that we're competing against each other is not great. I think that the one time when a federal response is really important is during a global pandemic. We need coordination. And so hopefully that will be a lesson learned through this process. I do want to just provide another example in addition to testing. I love to hear what Tobias was saying about Germany paid hospitals to keep beds empty. Well, our hospitals kept beds empty as well. Some of them are going to go out of business because of it. They were doing the right thing for our public as good stewards, and we're now hearing from hospitals, particularly in our rural areas, they're not going to make it, which makes us even less prepared going forward for similar types of situations. So this isn't intended to be sort of political rallying. This is really more for me about good public health practice and capacity to respond in situations like this. And I'm really hopeful that in the States, we will learn some lessons from this and become stronger because of it. And I think we generally have figured out ways to do that. Sorry, I didn't mean to get off on a rant.
That was a wonderful comment, Stephanie. And I guess I'd like to ask both you and Blaine if you think that this pandemic might lead to a new debate about public health in the United States, because I think that it has shown how sort of woefully unprepared we are for this kind of a situation.
I think so. I think from a policy level, and Stephanie was right on point. I mean, my goodness. I need to bring her for more lectures because she's right on point. It's going to change dramatically the landscape of how we provide health. And, as I stated earlier, even to the point of how the digital divide has affected the healthcare industry, where you now have doctors saying do virtual visits. Well, if I don't have access to the right tools to do a virtual visit, then I don't even have access to even get screened and even to do a test. So even how you look at digitalization and how that figures into the healthcare industry, all of those things are going to change the landscape of the healthcare industry dramatically. And we also are dealing with health systems that are under the of now cutting about 20% or asking their members of their healthcare, in addition to risking their lives to do this, now they're having to cut their salaries by 20%. So this is going to change the healthcare industry and the public health industry, the public health arena, tremendously, in my opinion.
I do hope that that is true, and I remain optimistic. I will say that our local health department just had to furlough about 30 employees this week, or put employees out of work at the health department, our public health department, because of budgetary issues in the middle of a pandemic. So, I mean, I think this is a really serious problem. And I worked in public health during 9/11 and, Katrina. We're sort of in an area where we were a catchment area for some of our Katrina refugees. There were a lot of changes at that time and that happened as a result of those events in the public health system and our emergency response system. We've lost a lot of our memory around those issues, and a lot of funding has gone away. So I do hope that this that brings some of that capacity back. I'm going to be optimistic about it.
So I'd like to stick with you both, Blaine and Stephanie, for one more question before going back across the Atlantic to Jimmy and Tobias. Both Jimmy and Tobias talked a little bit about the reopening of the economy in their respective cities. And of course, this is the big debate that we're facing here in the US. How do we go about lifting current restrictions? How do we go about, bringing everything back online? Just yesterday, the governor of Tennessee, Bill Lee, announced that many restaurants across the state could resume limited dine-in services, but he excluded big cities like Knoxville, Memphis, and Nashville. At the same time, we're hearing about the states of South Carolina and Georgia lifting social distancing starting on Monday. For the two of you, what are your thoughts on what the impact could be of going back to normal too quickly?
I'll start there. This has been my life, and the 11 o'clock meeting that I have is exactly about this. So is developing a plan for reopening, which I believe we have to do. I mean, at some point, I liken this in public health to, abstinence only education will only work so long. And at some point, it's not going to work anymore. And you have to have good protective measures in place, because those teenagers are going to be doing things that you don't want them to do, and you don't want them to get pregnant, right? So we don't want to follow the abstinence only model. We have to have a measured, science-based plan that also considers the social science of how people are going to behave. We're working on that plan in Knoxville, and I think, we actually, because we were able to not just flatten our curve, but we really crushed our curve here in Knoxville. We were very, very lucky. And I think we can start some measured, we have a 3-phased reopening process that is all tied back to the best science and both in the social science, health science, public health science. We have business leaders involved in helping to develop that. So the challenge is, helping people to understand that this is a new normal, that we're not going to be able to go back to just doing things the way we were until we have a vaccine. And so that's sort of the approach that we're taking, rather than being the abstinence only community in the middle of a state that's opening things up. That's not going to work either. So we have to be real practical about how we're going about it.
And I would just add, I agree that the abstinence only model is not going to work. However, in environments that we live in, like Cleveland, there's too many uncertainties right now for us to jump into just trying to go back to normal. Stephanie's right, there's going to be a new normal. I'm for really trying to do a scientific approach to how we open up, but I don't think that just starting to tell everybody hair salons, beauty salons, and I miss my barber dearly, believe me. But I don't believe that it is, a great idea to just just open up everything, that I do think that we need to have a tiered approach. We still need to have some controls. We still need to have some edicts where in some places you have to wear masks and other things like that. So I think that there's just too many uncertainties in the way that some of these governors, some of these cities are operating, I think is irresponsible, because there's too many uncertainties. And if we have another spike, then you think it's going to be hard to jumpstart the economy now. If you get another high reinfection rate and this thing spreads again, then we'll really be in trouble. So I think it's kind of difficult to say that we should open up right away, but I do believe that Stephanie's right. We can't have an abstinence-only model forever. We do have to have a tiered approach in how we open certain things.
So as we all sort of try to navigate this uncertain and indeed unprecedented territory, I want to come back to Tobias and Jimmy, because I do think that Germany is a little bit ahead of us on some of these things. Are there certain health metrics or benchmarks that you've been using in your cities to determine or help determine if it's safe to reopen businesses? Sort of, have there been any tools in place that you could share with us?
Shall I go ahead?
Yeah, Jimmy, go ahead.
Yeah, I mean, I think what Blaine just said, and also Stephanie, there has to be a concerted initiative, obviously. I mean, if we open the stores in Heidelberg and Mannheim does not, then everybody from Mannheim shops in Heidelberg, and all the social distancing goes down the drain. So that's why we are trying to do this statewide, and also, as you know, mostly federal-wide. And I must say the benchmarks changed over the last weeks. They got kind of more strict over the time. So I guess politicians as well as the scientists wanted to be really, really sure that they did not go ahead too early. And I think right now it's that every person that's infected in Germany infects less than one other person. And I think that was one of the benchmarks that was supposed to be achieved before reopening starts. And that has been for a while now. But even though stores were reopened, there were really strong restrictions. So you still have to have the distance from 6 feet. There are approximately one customer per 20 square feet. And you have to have, if people wait in line at the in front of the store, you have to have these marks on the floor that they keep apart 1.5 meters, so 6 feet. And they, as Tobias mentioned, they have to wear masks from Monday onwards, and you have to have these shields at the cashiers. So it's not just that the stores just opened. There are a lot of restrictions going along with it, and it now I mean, it depends if people really kind of work with this and stick to it, and the infection figures stay low. We are okay, but if not, I mean, I think Merkel also made it clear that this is kind of a little bit of an experiment. I mean, if people try to do more than that would be wise at the moment, and don't stick to the rules and regulations and get ahead of themselves, I mean, this could very easily be rolled back, and we hope it's not. But so it's up to every single person basically to make sure that we still keep the distance, wear our masks, and not hang out with 18 people on the lawn. So this is all part of this whole experiment, and every single person has to make sure it works. Otherwise, we might be back where we were 3 weeks ago.
Tobias, do you want to add anything to that?
Yes, I could agree with you in all your topics. We have to be very, very careful for the next days. The next days will decide that we were successful. And it's a part of our daily discussion. All day we're discussing about the situation in the streets. We're discussing with the police. Do the people reflect all the restrictions? Does it work? And we fear that all this process will continue through this year. So maybe we will have some times where we have lower restrictions and bigger restrictions and tougher restrictions. It will take all the year. But I think that will have had a huge impact on our economy and our job market. Millions of people are currently unable to go to work. In Germany, we have an instrument, it's called short-time work, and it means the state pays the wages for the workers, at least 67%. This helps very much. This helps very much that all the people don't lose their jobs, and they don't have to be fired, and they can come back even in better times. Hopefully, it will decrease the impact on the economy and the next days it will come. But this will also have an enormous tax consequences for our cities. So we are now working on our budgets for the next years, and we're not quite sure how we should plan for the next years without the taxes from the companies.
Mm-hmm. I mean, I think that's a big question for a lot of cities, obviously for national governments as well. How does one pay for all of this? Tobias, I think your point about Kurzarbeit or short-term work is a very good one. In Germany, in addition to having a solid social welfare net and a stronger public health system, there are some safety nets that will come to bear in a crisis like this, and will also make it easier when the time comes for the economy to get started again, because people will be able to go back to work in a more structured way than we have in the US. But across the US, I've been hearing mayors talk about, we need to make huge investments now, but this is going to be difficult in years to come. And I see all of you sort of nodding your heads that the financial side of this is a huge challenge. Stephanie, since I know that you need to leave in just a few minutes, I wanted to give you an opportunity to make any last word or comment that you'd like to make, and then I'll continue with the other three. But it's been a delight to have you with us today.
No, thanks so much. This has been wonderful, and I really appreciate hearing from all three other panelists. I've learned some. I've been taking notes. We're all learning. This is, regardless of where we're at and how strong our system is, I don't think any of us have faced anything like this in our lifetime. So, and I'm sort of hopeful that I don't again. So hopefully we're all learning a lot. It's good to learn from each other. And I would love to continue to do this kind of exchange around these issues. You could probably tell from my orientation, I'm really sort of thinking about big picture, like how are our systems working and how can we make them work better to have the best outcomes for our community. But there are lots of details that I could also talk with each of you about. So any time or opportunity to do that would be just welcome, a welcome opportunity for me. Thank you.
Well, Stephanie, I think you've touched on the silver lining of the current situation. None of us could have imagined, 6 weeks ago that our programming would become a series of Zoom conversations. And as we at the ACG have seen how cities have been affected by the pandemic and thought about the area that we've put a lot of time and energy into over decades of bringing together practitioners like yourselves, we thought this is exactly the group that we would like to harness to continue the discussion. So this is literally just the first of at least 4 sessions that we've already mapped out in the coming weeks that deal with various aspects of how cities are affected by COVID-19. And I just want to thank you again for being part of this. But before we wrap up, Blaine, I want to come back to you. You touched on the issue of the digital divide earlier in the conversation, and you touched on it specifically as it relates to the healthcare industry, but there are so many other aspects as well, right? With kids not able to go to school and having to, go to school remotely, there are questions about, do they even have the hardware? Do they have the internet access in order to be able to get online? Do you see the digital divide that already existed in Cleveland being exacerbated by the current situation, and what's being done to narrow that gap?
It definitely has been exacerbated, and I was fortunate to have a personal call with Senator Sherrod Brown last week, who's one of Ohio's senators, and that's one of the issues I brought up with him, not just with schoolwork with the kids, but the future of work. A lot of people have to work remotely now. When you talk about doctor's appointments, even if you just talk about common safety, I mentioned my stepmother earlier. If we would have had the opportunity to be able to have a Zoom call like we do now, you know, we would be able to keep our eyes on our loved ones and our elderly in our homes, to be able to do that things. Because some of the tools that we don't have in place, and some of the statistics show that in Cleveland, it's approximately 30 to 35% of the households that don't have access to the right digital tools in order to participate the way that we should. We're in a deficit, and that affects us, how we social distance. That affects how productive we are. That affects us with our urgency to get back to work. So the digital divide, and I want to thank ACG, because spending the time that I did in Germany helped me realize why this has to be so critical in the city of Cleveland in order to try to address the future of work, and basically the future of our healthcare, the future of our society, really by ramping up our digitalization and our connectivity in the city of Cleveland.
Thank you, Blaine. Let me perhaps in closing turn to you, Tobias and Jimmy. Are you seeing the same kinds of challenges in your cities in terms of people not having access to the tools and resources that they need in order to work from home? I mean, obviously some jobs are more easily adapted to working from home. There are others where one physically needs to be present. Tobias, you were talking about the number of people who find themselves un- or underemployed at the moment. But can you talk a little bit about the technology aspect?
I think one of the challenges a lot of parents have right now is the situation of homeschooling. To have enough time for the homework and enough time to care for the schooling of the children. It's a challenge for a lot of people, especially for those people who have to work not at home. They have to work not at home. That's a problem. I think our schools trying to work in the situation as good as they can, and I'm not quite sure that we will have a normal school system until the end of this school year in June or in July. Yeah, it's a problem. Yeah, it's definitely a problem.
And Jimmy, in Heidelberg? Jimmy, we can't hear you.
You can you hear me now?
Yes.
Okay, good. Yeah, the city of Heidelberg worked with the foundation, the Hop Foundation, and other partners, and they just provided the city schools with a new video conference program so that the teachers can actually teach them, because so far, I guess the same here as in the US, mostly the parents had to homeschool the kids. So they got an email with what kind of homework they had to do, and this new program obviously helps. It's more interactive, and they can not just talk one-on-one, but actually to their class. Because I agree with Tobias, it probably will take a while, even though some classes, some levels will start sooner than others, but it will take a while before everybody is back at work. And it's also obviously some people are better equipped digitally at home than others, and also it's all the space issue also. I mean, if you have a very small apartment with 3 kids at home bouncing off the walls, I mean, it's hard to really sit down and focus and do your homework. So that also obviously there's a divide, not just digital, but also depending on how your environment looks at home, where you can actually work and concentrate and teach. And it's not just for schools. I mean, also you mentioned the university earlier. They had a huge learning curve. The semester started on Monday, and everything is now digital. I mean, that was not planned, obviously. So even the history professor who would otherwise not have thought about teaching anything online is now providing online services, and they're teaching their students and discussing with their students online. But everybody got ready, and they started the semester and doing this all digital. So it really seems to be working. We will see. It might not be the same, obviously, as if you teach people in the classrooms and in the university itself. But people are really trying to do their very best.
Well, and I think that's, good food for thought for all of us. Everybody's muddling through together. This is a unique situation, an unprecedented situation, one that none of us could have imagined. And I just really want to thank all three of you, and of course Stephanie as well, for joining us today and kicking off this series. We have future discussions planned on issues like transportation, which we didn't get into at all today, education, and digitalization, and more. And we'd really like to keep all of you engaged. So I want to thank the three of you for being with us. I want to thank everybody for joining us today. And I look forward to future discussions with all of you. And I guess last but not least, just stay healthy out there.
Thank you. You too.
Thank you very much. Best from Germany.
Bye, everybody.